I would like to welcome my first guests, Cathy Harrison and Chris Garland. So Cathy, thank you so much for joining me today. Let's start with a really obvious question. What is a pharmacist and what does that role entail?
So a pharmacist is a healthcare professional who is an expert in medicines. So what that means is they are fully trained in everything about medicines, and that involves from the development of new medicines right through to their testing, through to their prescribing, their supply, and also following up how they're working and how well they're treating the disease that they've been prescribed for. Now, pharmacists are really highly valued within the healthcare system, and there's a huge demand for their skills and expertise at the moment. And they use their particular knowledge in medicines, and they get that really from their scientific background, so they understand really how medicines work in the body, and they use those skills and their expertise within the healthcare system to help patients, to make sure that patients are getting the right medicines to treat their conditions and prevent illness as well. But they also have a really important role in working with other healthcare professionals to advise on the best possible medicine for the disease or the condition that needs to be treated. Now, the reason why pharmacists are in such big demand at the moment, there's a couple of reasons. One is that we have so many amazing developments happening in medicines across the world. So there's fantastic new medicines being developed, lots of new technologies involved, and pharmacists are really at the cutting edge of understanding how those medicines work and how they will combine with all the medicines that are already used. And another reason why they're really in high demand and the role is so interesting is that our population uses a lot of medicines and we're all living longer. When you live to a good age, it means you tend to sort of gather up a few health conditions along the way, and they are usually treated with different medicines. And multiple medicines are quite complex in your care, so pharmacists are really important within our multidisciplinary teams within healthcare in Northern Ireland. And those multidisciplinary teams include pharmacists working with our doctors, our nurses and our other healthcare professionals to care for our patients.
So where might you typically come across a pharmacist? What are the main areas of practice?
So there's lots of different places where pharmacists can work, but the three most common that you will find a pharmacist working in are community pharmacies, and there's over 500 community pharmacies all across Northern Ireland in our villages and towns. And also you'll find pharmacists working in every single general practice in Northern Ireland, and there's over 350 of those, and also in all of our hospitals. So really a good way to think about it is anywhere where there's medicines being prescribed, supplied and used, you're going to find pharmacists.
So they're pretty essential.
They're really essential to good health, and they're really essential to sort of all of our goals in terms of improving the population health. I should say, the roles of pharmacists can change in the different settings that I've described, but there's a sort of a core role that they all have. So I've said they're experts in medicines, so that means they know all about the safe supply of medicines. They also know all about the interactions that might happen between medicines, the types of side effects to look out for in medicines, and so in that way they can provide really up-to-date advice on and provide sort of answers to any concerns that patients might have about their medicines. I've also said in all settings, pharmacists provide really good advice, and their expertise supports other healthcare professionals as well. But then if you think about our three big settings that I talked about there, in community pharmacy, our pharmacists really have a critical role. They're really on the front line, and that means they are often the first point of contact that people will have with our healthcare system. So as well as safely supplying medicines, they provide loads of advice on healthy lifestyles and other services. Like at the moment, they're providing vaccination services, and they also provide advice on stopping smoking, for example. And then in general practice, our pharmacists support all of their colleagues in terms of medication reviews and safe use of medicines. And in hospital, there's just a huge range of roles where they're very highly clinical roles, where pharmacists will work to support, again, the multidisciplinary team and dealing really these days in hospital with more complex patients.
So it's pretty varied then. What about the areas of research and academia? If you're more into that, is that something that pharmacy you can work with on?
So yes, so for some pharmacists, if they wish to, they can stay on after their degree and perhaps do a PhD, and that really opens up loads of other opportunities. So for example, they may go into research. Now, if you go into research as a pharmacist, you've got a really good chance of getting a job in the pharmaceutical industry. The pharmaceutical industry is we have some world-leading firms based in Northern Ireland. You could may be employed there, but also that industry is global, so there's a lot of really rewarding career opportunities. And the other area is you could stay on in academia, so you could stay on within the university system and go into teaching or lecturing. So there's really lots of great opportunities and great job security as well for pharmacy.
It sounds like there's so much scope for this. Thank you so much. That's a perfect introduction to what a pharmacist entails. Chris, welcome. Lovely to see you. We're going to hear just how attractive pharmacy really is as a career. But why is now a good time to be thinking about pharmacy in particular?
It's a really, really exciting time, Rebecca. As Cathy's just described, we're in the middle of a really transformative period in our health service for how we deliver healthcare. And it's because of our aging population. We have more older people taking more medicine. So the skills and knowledge of pharmacists as medicines experts are really in very, very high demand across all sectors. So there's lots of jobs and lots of opportunities for pharmacists at present. In order to prepare pharmacists for those roles, and Cathy's talked about the increasingly clinical roles, we're now starting to see real reforms to how pharmacists are trained and educated. So what we're seeing now is over the next few years, we will see changes to how the degree course is delivered, with an increasing focus on clinical patient exposure to patients much earlier on in the degree course. And this will help to prepare future pharmacists for these new clinical roles, working with other members of the healthcare team, such as doctors and dentists, and really having that hands-on exposure. So it's a really, really exciting time. There's lots of change, lots of development, and there really never has been a better time to be a pharmacist in Northern Ireland.
So tell me a little bit about post-university, and what is the journey that a pharmacist would expect to go on career-wise in terms of salary, progression, opportunity? Tell me a little bit about what that might look like.
Okay, so typically upon graduation from university, a pharmacist will undertake, first of all, a year's on-the-job training in a community pharmacy or a hospital pharmacy. Typically, that's a paid placement earning around 20,000 or so a year. So upon qualification then, more junior pharmacists will typically earn in the region of 30 to 40,000, and those roles are focused more on gaining experience in a wide range of pharmacy practice settings. So with increasing knowledge, skills and experience, a pharmacist can then typically progress on to more senior roles in clinical practice or in management. Those roles would typically be associated with salaries in the region of 50 to 60,000 a year. But in for some very senior managerial roles, for example, in the health service, typically attract higher salaries again, typically in the region of over 80,000 a year or more.
And in terms of your career, you spent a bit of time away. You're now back in Northern Ireland practicing pharmacy here. So tell me why. What was the draw? What made you come back home?
Yeah, absolutely. I mean, at the time when I first qualified, I've certainly seen the growth in opportunities in Northern Ireland. They certainly weren't maybe there when I was first graduating, but certainly I returned back to Northern Ireland a number of years ago, drawn back by the quality of life here, and certainly the draw of family as well. Of course, it's very, very important. But certainly, attracted by the cost of living and certainly the environment here in Northern Ireland. We're close to the sea, and the scenery is amazing. So certainly my experience in terms of the profession here in Northern Ireland, it's that, we're quite a close-knit profession. And my sense has really been that the leaders of the profession and policymakers and decision makers are so tuned in to the needs of pharmacists on the ground as well. So it's certainly something I haven't regretted for a second.
Well, we're delighted you're back. It's great to have you here. Thank you both so much. It sounds like there's an awful lot of scope for people who want to get involved in pharmacy here in Northern Ireland.